is it Tuesday? I'm pretty sure it's Tuesday, and it's 7 o'clock. So there's questions to be answered, and I'm around to do the job. So if you've got a question, then ask. Simple as that. That's the only way you're going to get it answered. If you don't ask, don't moan about not knowing the answer to the question, because we all gotta put our hand up, haven't we, and ask. So, but if you haven't got a question, or if you don't want to ask, then that's fine. You don't have to. You can message me, and I will do it next week, or just quietly to you. You may not make the cut for one of the elite questions that we actually have to filter through to get the very best question for the Q&A. So questions like this one here: can you remove a mucoid cyst? So a mucoid cyst is a cyst on the joint of the finger, usually on the distal joint, at the end joint at the tip of the finger, usually due to arthritic changes in the joint. And I don't do them. I don't know. Sam is does a lot of hands. Sam George, who's one of the surgeons, works at the clinic, and he might do them. I think they're a little bit more difficult than you might think, because it's not just like a cyst. A cyst is usually quite easy because you can get to the bottom of a cyst and remove a cyst, whereas these you can't get to the bottom of them because they're outpouchings of the joint, like a ganglion, and so they can recur and things like that. So they're a bit more difficult. So I don't even know if he'll do them, to be honest with you. I don't do them, but we'd have to ask Sam. I know you can argue I should have asked Sam before I came on. That's a fair argument. I'll take that on board. I'll take that feedback and I'll run with it. Yeah, maybe I should have looked at this question before I came on live on air. But hindsight's a very, very precise science. Do we offer septoplasty? No, we don't do. So septoplasty is a nose operation. The septum is the bit between your two nostrils, and sometimes if it's deviated to one side or other, it can make your nose look deviated, and it can also block your airway, the nasal passage, and so you can do a surgery to change the shape of the septum, which is a septoplasty, but we don't do it. We don't do noses. So no, we do, well, breast and body was the mainstay of my work, but I'm doing more and more of the local anesthetic stuff now. Mole cysts, we're transitioning at the moment into mole cysts and lesions like that. But no, I've never done noses. Do you remove suspected melanoma on scalp? How do you decide what margin to take? It's a bit of a technical question. Yep, we would remove a melanoma on the scalp. So the thing about a melanoma is that it's often difficult to be sure it's a melanoma before you take it off, and sometimes you might not even think it's a melanoma before you take it off. It's just a mole, maybe a changing mole, maybe a worrying mole, but until you've got histology on it, then you don't know if it's a melanoma or not. So the right way to treat a melanoma, so the answer is yes, we would remove a melanoma on the scalp. The right way to treat a melanoma is to take off the lesion, take off the mole, send it away for histology, and get a result there to tell us whether it's a melanoma or not. Because obviously if it's not a melanoma, that's that. If it is a melanoma, then we would go and take a wider margin. But the problem is the margin that we take is dependent on the depth of the melanoma, in terms when they look at it under a microscope, how deep it's invaded. So that's a microscopic measurement. You can't see that by looking. You can't tell how deep a melanoma is by looking at it. You have to send it away for histology. And so you might need a 1 or 2 centimeter margin around the scar. So with a melanoma, you need another operation afterwards, which is a wide local excision of the scar. And sometimes there'll be things to do in terms of the lymph nodes, sentinel node biopsies, things like that. But in terms of the margin, we wouldn't take a margin of the original lesion. So there'd be no point in taking a 1 centimeter or 2. You just don't take a margin, simply because 1, you don't know what it is, and 2, you don't know how deep it is. So you would take it off with a kind of just a few, like 5 millimeter margin, and then you would wait for the histology to come back. The problem with the scalp is the skin on the scalp is quite tight. And so it can be a problem if you can't close it. So what we normally do is cut the melanoma out and stitch it up, and then come back another day and do a wide local excision of the scar. And usually the wide local excision, because usually it's 1 or 2 centimeters, requires some kind of reconstruction to fill the defect, which would be a skin graft, classically maybe a flap. But the problem with them, if it's a kind of big mole on the scalp and we would struggle to close it, then we've got an issue as to what we do, because you don't want to do a skin graft for the first op where you just take the thing out, because you know that there's a good chance you might need to do another op, and so you don't want to sort of cut out your skin graft for the second op. So then you might just put a dressing on it for a while and hopefully get a quick result, ideally, because you ideally want to get the whole of the lesion out and send for histology. You don't really want to do a little biopsy of it. You don't really want to take a little piece of it away. That's not really a good thing to do for melanoma. For melanoma, you want to take the whole lesion out, so that it is troublesome when you've got a quite a big lesion in a difficult area like the scalp or like the hand, palm of the hand, sole of the foot, things like that. But yeah, the general principle is you take the lesion away, the mole away completely, you get it sent for histology, and then when you know A, whether it's melanoma or not, and B, how deep the melanoma is, that's when you would go and do a wider margin, which will be 1 or 2 centimeters, depending on the depth of the melanoma. And that usually requires some kind of reconstruction, usually a skin graft, and we have to go quite deep with that wide excision down to fascia. So the skin graft often kind of sits in quite a dent. You take quite a large piece away when you do a wide local excision after a melanoma. How long does it take for histology results after having a lesion removed? We used to say 2 weeks. We've started saying 3 now. So it must have got longer. So we don't want people being upset if we've said 2 and it takes longer. So yeah, so I'm going to say 3, 2 or 3. Well, 3 weeks is the answer to that question. 3 weeks, give or take. I saw a dermatologist and she wants to shave one of my flat moles of my thigh. How can that be if you shouldn't shave a flat mole? Yeah, I saw this actually comment on my video, my YouTube video, and someone put this comment, I think, did they? Where did I see it? Or I saw it somewhere. Yeah, it was on a YouTube video. I don't know is the answer. I'm not sure how you shave a flat mole. I guess you kind of take a divot, like a golf. Like you take a divot of the earth if you hit the ground with a golf club. I guess you do that, but then you're going to get a dent. So shaving a flat mole is not something that I would do. If it's like, so the shave requires it to be raised, and then you take it off at the level of the skin. And if it's not raised, then I personally wouldn't do a shave. So I don't know. You better speak to a dermatologist, really. I guess the answer to that. Now, I've got kind of if not what DMX. You got a question? If not, please recommend a dermatologist that does. Sorry, that does what? Was that one of the questions? Recommend a dermatologist that does shave flat lesions or Septoplasty. Oh, Mucoid. What do you recommend a dermatologist? So DMX 011, a dermatologist that does. I asked previously whether you treat granulomas on skin. Oh, did you? Blimey, I missed that. I'm probably getting loads of. Oh, I see. Can you let me know if you treat granulomas on the skin? Yeah, I can see it now. Sorry. It's because my t-shirt's the same colour as the words. So wear a black t-shirt next time. Yeah, I mean, we would treat a granuloma on the skin. The only thing about granulomas is they will often respond to non-surgical treatment. So we do surgical treatment at the clinic. So we sort of cut things out And so that might be a bit extreme if it's a granuloma. Granulomas can often be treated with things like silver nitrate and what have you. So if your GP can't treat you, then maybe a dermatologist, or you want me to recommend a dermatologist. Well, if you're in Birmingham, Michelle Thompson is at the Priory. I think it's called the Birmingham Skin Clinic, and she is a dermatologist. So she might be able to help if it's... yeah, so often we do things like silver nitrates and topical treatments for granulomas. So we could treat it, but it might be a bit extreme for us. If you want, you can send us a photo. That's what a lot of people do. Send us a photo, say, what do you think? And we'll say, look, we can do it and it'll cost you this much money, but it might be worth having a look at some non-surgical things. Right, thank you. You're welcome. You're welcome, DMX001. Honestly, glasses, God help me. Going up every time I go to the optician, my prescription is getting worse. Going up and up and up. Oh dear, oh dear. Do you offer nasal dilation surgery? Now, that's strictly speaking, I believe that should be dilatation rather than dilation. I think the word is dilatation. Nasal dilatation surgery. I've got to be honest, I don't even know what nasal dilatation surgery is, or dilation. Nasal dilation. What, opening up your nostril? I mean, I think by that answer, if I now turn around and said yes, we'd have a bash at it. You probably wouldn't want to come to us. So, yeah, it's a no. We don't offer nasal dilation or dilatation surgery. I've not heard of it, I'll be honest. Opening up the nose. Again, it's a nose thing, isn't it? It's a rhinoplasty, changing the shape of the nose job, rhinoplasty. So I don't do rhinoplasty. So I decided a long time ago not to do rhinoplasty. I think rhinoplasty is one of those things that you have to kind of do a lot of and specialize in. So people who dabble in rhinoplasty, it's a difficult game. So I decided not to dabble in rhinoplasty many years ago, and I don't. So and I don't miss it because I think it is quite tough to get it right. It's quite subtle and things like that. So I don't do noses, and you're better off seeing a nose guy for that, nose man. Yeah, I'm sure I've got loads of questions come through on the chat. I'll say hi. Yeah, I'll say hi to you guys. Hi. Oh, say hi. Yeah. What we got here? Please recommend. Oh, that was the last one. Okay, that's fine. We've got loads on it. Oh, right. Okay. Yep. Okay, that's fine. Yeah, that's not a problem. Yeah. Well. All right. Well, if you've got a question, it's fine. So yeah, 7 o'clock next week. I'll be back. And if you've got any questions, please feel free to ask them. I'll do my level best to respond. Hey, baby, that's a question, I suppose. And I will bid you good night. And yeah, have a nice evening. See you next week in the chat.